Hello, I'm Dr. Joe Pizzimenti of Boca Raton, Florida. And like many of you, I've been using scanning lasers in the diagnosis and management of glaucoma for over 20 years. About 6 years ago, I made the decision to increase my practice's efficiency, its diagnostic and management capabilities, and its revenues by transitioning from my GDX nerve fiber analyzer to CIRRUS high-definition spectral domain optical coherence tomography. You see, the older generation scanning lasers limited my digital imaging capabilities to just one disease, glaucoma. My new CIRRUS spectral domain OCT immediately became a difference maker by adding so much more usable information, not only for glaucoma, but also other optic neuropathies, plus a host of vitreoretinal diseases, corneal pathologies, and anterior segment disorders. Let me take you on an historical timeline showing some of the major milestones in ophthalmic imaging. Fundus photography came about in the 1920s. About 30 years later, the first fluorescein angiography was performed. B-scan ultrasonography was brought to clinic in the 1970s. Indocyanine green imaging employed an alternative dye to fluorescein and digital imaging technology in the 1980s. In the 1990s, we saw the emergence of the scanning laser ophthalmoscope and another technology known as scanning laser polarimetry came about. Scanning laser polarimetry is the technology that is used by the GDX nerve fiber analyzer, both the VCC and the GDX Pro. OCT, and that is optical coherence tomography, was first demonstrated in a lab in 1991. The Stratus OCT was the first commercially available OCT for ophthalmic imaging, and that was brought to market in 2001. 2007 saw the emergence of high-definition spectral domain optical coherence tomography. And here in 2013, we can see that the CIRRUS family of spectral domain OCT represents the most cutting-edge, forward-thinking option for ocular disease diagnostics. In fact, spectral domain OCT with the CIRRUS instrument has revolutionized eye care and has revolutionized the care that I am able to provide in my practice. Scanning laser polarimetry with the original GDX technology enabled us to obtain information on retinal nerve fiber layer thickness and integrity. And these measures became useful biomarkers for glaucomatous damage to the retinal nerve fiber layer. The purpose of this technology, scanning laser polarimetry, is to measure the retinal nerve fiber layer thickness and integrity to help clinicians discriminate between healthy and glaucomatous eyes. The next generation, called the GDX VCC, incorporates a variable corneal compensation mechanism to neutralize birefringence that emerges from the cornea and the anterior segment, while the GDX Pro, which you can see on the right-hand side, continued to improve the reliability of retinal nerve fiber layer measurements. Let's review the individual elements of the GDX retinal nerve fiber layer OU analysis report, with which most of you are undoubtedly familiar. As we look at the top of the report, we can see patient demographic information as well as indices that indicate the quality of the scan. Then we have our scanning laser images for the right and left optic nerves, respectively. And in the middle of those two scanning laser images, we see a table of information related to retinal nerve fiber thickness in the various regions surrounding the optic nerve head. We also have an index of inter-eye symmetry and the NFI, or nerve fiber index, a unitless measurement that predicts the likelihood of glaucomatous damage. So below the scanning laser images, we can see the retinal nerve fiber layer thickness maps. And the brighter the colors surrounding the optic nerve, the more robust and healthy the nerve fiber layer. So these are a pair of healthy eyes on our demonstration patient here. Below the thickness maps, we have our deviation maps that show the statistically significant deviations from the normative database. And finally, on the bottom of our report, we have our T-SNP graph with a comparison of the retinal nerve fiber layer thickness between the right and the left eyes in the center of that graph. In addition to the standard OU analysis, the GDX VCC and GDX Pro can provide serial analysis, showing, in some cases, progressive retinal nerve fiber layer loss over time. Here you can see that a number of measures were taken on the patient's eye over a period of time, and we can see some progression of glaucomatous damage, indicating that we need to be more aggressive in our IOP lowering. Although the GDX VCC and Pro instruments provided improved accuracy over the first generation technology, we were still dealing with 1990s imaging methods and clinical application that was limited to glaucoma. CIRRUS high-definition OCT, on the other hand, uses 2013 technology to help us diagnose and manage glaucoma and much, much more. The first benefit that I immediately noticed after transitioning to CIRRUS OCT was better patient care. How so? Well, I was now able to detect and image various ocular conditions earlier than ever, resulting in earlier treatment and improved visual outcomes for my patients. In reviewing the CIRRUS OCT glaucoma analysis elements, it's important to notice several similarities between the CIRRUS report that you see here and the GDX report that we showed in one of the previous slides. And some of these elements in common include the retinal nerve fiber layer thickness map and retinal nerve fiber layer deviation map, as well as the T-SNP graph, which you can see on the upper right. Of course, the T-SNP graph represents the average retinal nerve fiber layer thickness along the data circle that was generated around the optic nerve, from the temporal aspect to the superior, nasal, inferior, and once again temporal nerve fiber layer. A welcome addition in glaucoma diagnostics with the CIRRUS instrument is the capability to perform cross-sectional imaging of the optic nerve, the optic cup, and the retinal layers. And you can see this cross-section in the lower left-hand aspect of this slide. And so here's a comparison of the glaucoma analysis capabilities of the GDX versus the CIRRUS OCT. And we can see that both instruments are able to generate a T-SNP map, a retinal nerve fiber layer thickness and deviation map. Some serial analysis can be performed with the GDX instrument, but true proprietary guided glaucoma progression analysis with advanced statistical analysis is available only on the CIRRUS OCT. Cup to disc ratio information, not available on the GDX, but is available on the CIRRUS OCT. In terms of retinal nerve fiber layer thickness, the numbers are interpolated or estimated on the GDX instrument, and they vary relative to the birefringence from the nerve fiber layer, whereas in CIRRUS OCT, the retinal nerve fiber layer thickness can be directly measured in microns. Whereas the CIRRUS OCT provides valuable information about the retinal ganglion cells, the GDX analysis is limited primarily to just the retinal nerve fiber layer. The CIRRUS OCT provides a scanning laser image of the optic nerve with the optic cup and the optic disc borders identified for you. The statistical analysis table on the lower left-hand part of the slide is easy to interpret, as the areas of concern are color-coded. Note that this table provides more than just retinal nerve fiber layer thickness and symmetry information. It also quantifies the neuroretinal rim area, a crucial measurement in considering whether or not a patient has glaucoma and whether or not that glaucoma is progressing. So it quantifies the neuroretinal rim area. The CIRRUS also measures the relative size of the optic nerve head, calculates cup-to-disc ratios, and optic cup volume, all very useful information in the diagnosis and management of optic neuropathy. Here are two patient cases that illustrate both some similarities and differences between the GDX and the CIRRUS OCT technologies. Let's review the CIRRUS retinal nerve fiber layer and optic nerve cube printout on a middle-aged black female that has been living with bilateral open-angle glaucoma. At the top of the analysis report, we can see that there are both patient demographic sections as well as reliability indices such as signal strength. Then we have our retinal nerve fiber layer thickness map, which is analogous to the thickness map that we also receive from the GDX instrument. Now we can see that with respect to our patient here, there is some mild to moderate nerve fiber damage both superiorly and inferiorly on the right eye, and more severe damage as a result of more advanced glaucoma in the left eye. In between the two thickness maps is our data table showing parameters such as average retinal nerve fiber thickness, retinal nerve fiber layer symmetry, and using color codes to highlight those areas that may indicate glaucomatous damage and glaucomatous progression. We also have information on the neuroretinal rim, the area of the optic nerve, average cup-to-disc ratio, vertical cup-to-disc ratio, and optic cup volume. Below that, we have our retinal nerve fiber layer deviation map that has been overlaid on the OCT fundus image for the right and left eyes respectively. And we can see in these deviation maps that the left eye clearly demonstrates greater deviation from the normative database. In between the two deviation maps, we have a graphical representation of neuroretinal rim thickness around that data circle. And we can see that there is, in fact, a significant difference as we look at the OD and OS comparison, with the left eye demonstrating more diffuse and localized nerve fiber layer loss and neuroretinal rim thinning. Below the deviation maps, we have our T-SNP retinal nerve fiber layer thickness that has been calculated along that circle, and it's displayed in graphical format and compared to the age-matched normative database. Now, retinal nerve fiber thickness and comparison to normative data is shown both in quadrants and in clock hour displays in the lower central aspect of this printout. Now, we also receive cross-sectional imaging of the optic cup, the optic nerve, and the retinal nerve fiber layer, so we can assess both the width of the optic cup, the depth of the optic cup, and the thickness of the retinal nerve fiber layer. So here's the same patient's GDX analysis with similar scanning laser images on top. We have our thickness and deviation maps, and our T-SNP graph, all very similar to the information generated by the CIRRUS instrument. However, there is no information here on this printout about the condition of the neuroretinal rim, the optic cup, or the cup-to-disc ratios. This type of analysis is not available on the older generation GDX instrument, but only available on the CIRRUS HD OCT. Both serial and guided progression glaucoma analyses are available on the CIRRUS OCT using a robust normative database for comparison. We can see the 2 baseline exams are required for this advanced progression analysis. The 3rd exam is then compared to the 2 baseline exams. Below the thickness maps, we can see a subpixel map that demonstrates change from baseline, and those yellow pixels indicate change from both baseline exams. The 3rd and 4th exams are then compared to both of the baselines, and any change identified in 3 out of the 4 comparisons is indicated by the red pixels that you see here. The CIRRUS progression analysis on our patient's right eye shows that despite our best efforts, there is retinal nerve fiber thickness map and T-SNP profile progression of glaucomatous damage. And so this patient soon received selective laser trabeculoplasty in an effort to achieve optimal lowering of their intraocular pressure. Here's a 75-year-old white male that has plateau iris syndrome in his right eye with moderate glaucomatous damage as shown here on his GDX report. It's especially apparent as we look at the retinal nerve fiber thickness maps where we have bright, robust nerve fiber layer in the left eye, and in comparison, the right eye has areas of deficit completely surrounding that optic nerve, so 360. And this is reflected in the table of summary parameters as well as the T-SNP map and deviation maps. In comparison to the GDX, the CIRRUS OCT on our same patient provides much more information, including neuroretinal rim thickness asymmetry, which we can clearly see in the center of our printout. Also available are the retinal nerve fiber layer quadrant and clock hour analyses. Finally, we can see on these extracted cross-sections in both the vertical and horizontal cuts, we can see a widening and a deepening of the optic cup of the right eye as a result of the plateau iris syndrome. So quite a bit more information, quite a bit more valuable data in terms of following our glaucoma patients with the CIRRUS OCT. So in addition, the CIRRUS OCT provides ganglion cell analysis. And as we know, glaucoma by definition is a progressive ganglion cell loss. Now here, our ganglion cell analysis on our patient with the plateau iris syndrome clearly shows that the ganglion cell thickness has deficits in the right eye in comparison to the left eye, which has relatively normal ganglion cell thickness. So this is another very useful parameter, not only for glaucoma, but for following other optic neuropathies. For instance, patients living with multiple sclerosis who may have a mild to moderate degree of optic nerve atrophy. Here are some other advantages of spectral domain OCT technology. First of all, OCT data is a cross-sectional volumetric cube of information. It is not estimated, nor is it interpolated. Spectral domain OCT measures thickness in microns on the retinal nerve fiber layer and ganglion cell layer analyses. Finally, OCT provides information about multiple structures, including the nerve fiber layer, the optic nerve head, the neuroretinal rim, as well as the vitreoretinal interface, the macula, cornea, iridocorneal angle, and other structures, other ocular tissues as well. OCT also provides more value and more information for your time and your practice. So here's just a short list of retinal pathologies that you will be able to diagnose, image, and in many cases follow yourself without having to obtain a retina consult. This is beyond the capability of the GDX instrument, but well within the capabilities of spectral domain OCT. So if you're seeing many patients with glaucoma, chances are you're also seeing some patients with retinal disease. Common conditions such as drusen, both dry and wet macular degeneration, diabetic retinopathy with or without macular edema, central serous chorioretinopathy, retinal vascular occlusions, hereditary conditions such as cone dystrophy, Stargardt's disease, retinitis pigmentosa, vitreomacular adhesion and vitreomacular traction that can lead to things like cystoid macular edema, macular holds, and epiretinal membranes. The detection of retinal pigment epithelial detachments becomes much easier with cross-sectional, volumetric 3D imaging available with OCT. When one considers that so much more can be uncovered with CIRRUS OCT than with the GDX, the value for your time and practice grows exponentially. Here we can see that the test time for both of these scanning lasers is less than 5 minutes. But for that 5 minute of test time, the data that you are acquiring with CIRRUS OCT is approximately 4 times that you've acquired with the GDX. And that enables a wide variety of clinical applications. Things open up beyond glaucoma. As we said, cystoid macular edema, common retinal diseases. You will also be able to do excellent pre- and post-operative management of patients that have undergone an epiretinal membrane peel, as well as intravitreal injections for conditions like wet macular degeneration and diabetic macular edema. CIRRUS Spectral Domain OCT has several ways to analyze the data cube for macular disease alone. So let's review just a few of these. There's the macular thickness analysis report, advanced visualization analysis, and high-definition 5-line raster scan with analysis. So here is a macular thickness analysis, and this report clearly shows that our patient has central serous chorioretinopathy. And the OCT can actually help us diagnose based on appearance of the OCT. So we can see here that on the lower left-hand side, the cross-sections clearly show an area of subretinal fluid right in the center of the fovea. And this is pathognomonic for central serous chorioretinopathy. On the upper left-hand part of the analysis, we have a thickness map superimposed over our scanning laser image. And those bright areas on the thickness map once again indicate that there is fluid, in this case in the subsensory retinal space. To the right of that image, we have the internal limiting membrane to RPE thickness grid, where the average thickness in 9 zones centered around the center of the fovea is calculated. And we can follow this patient over time, hopefully watching them return back to normal thickness values. On the right-hand side, we can see the segmentation analysis that shows both the thickness and single-layer analysis, where we can isolate the internal limiting membrane, and on the bottom in brown, the retinal pigmented epithelium. This is the same patient, and I just wanted to show you that Above, we have the image that is generated by the scanning laser ophthalmoscope in spectral domain OCT, and we have the individual cross-sections both in black and white and also in color. This is a 64-year-old radiologist with a family history of advanced age-related macular degeneration. Now we can see here on the macula thickness analysis that as we look at the cross-sections, there are some areas that appear as bumpy nodules at the level of the pigment epithelium. Now these represent several large soft drusen that put this patient at risk for advanced disease just like his mother had. On the right-hand side, we can see that the segmentation analysis resembles a small mountain range, especially in the internal limiting membrane to RPE segment and the retinal pigment epithelial segment on the bottom. Here's the high-definition 5-line raster scan report in both black and white and color for the same patient with a large drusen. Now, in the cross-section that we see on the bottom, in black and white on the right and in color on the left, we can see large bumps representing large soft drusen. Macular holes can be detected quite a bit more easily with OCT technology. In the image above, we see 3 intraretinal cysts. So anytime we see dark areas within the OCT cross-section, that means that there is intraretinal fluid. On the lower left-hand side, we see a partial thickness or lamellar macular hole. Note that there is still some viable sensory retinal tissue within the center of that partial thickness hole. On the other hand, the black and white image on the lower right shows that this patient has a small diameter but full thickness macular hole, and note that there is some cyst-like area of change on either side of the hole. Conditions such as diabetic retinopathy can be imaged not only with high-definition fundus photography, but now we can get the volumetric imaging with spectral domain OCT. And this has enabled us to detect areas of intraretinal thickening and intraretinal fluid on a patient with diabetic macular edema. OCT has revolutionized the detection, management of patients with disorders of the vitreoretinal interface. We spoke about macular hole a few slides earlier. This is an example of advanced visualization on the OCT of an epiretinal membrane. This patient also has a pseudo-hole, as we can see in the cross-section in the middle of the right-hand side of the report. Also note the surface wrinkling that is apparent on the NFOS images that were generated using advanced visualization strategies on CIRRUS OCT. We can manually guide our 5-line high-definition raster scan to include the macula, the optic nerve head, or both. In this case, on the right-hand side, we can see both the optic cup and portions of the macula and fovea in cross-section. On the lower left-hand side, the HD raster scan is able to help us generate a 3D rendering of the retinal thickness. In this case, it appears the patient has, once again, a large area of drusen, resulting in elevation of the retinal pigment epithelium. Plateau iris and angle closure glaucoma is pathology that is beyond the capabilities of GDX technology. The CIRRUS highlights these areas of narrow angles and plateau iris, and this will help us provide better care for our patients with glaucoma. Another application for CIRRUS OCT includes the measurement of central corneal thickness in a completely non-invasive manner. And so we have anterior segment imaging with an anterior segment cube. Here we see the cornea and the red area indicates central corneal thickness, an essential measurement in the management of patients living with glaucoma. Zeroing in on that cornea cross-section, the light blue arrow is pointing to the tear film. Then the white arrow is pointing to the corneal epithelium. The red arrow is headed toward Bowman's layer. In between, we have the large area of stroma, and then the green arrow is zeroing in on Descemet's membrane and the corneal endothelium. So this allows the CIRRUS instrument to assist us in the diagnosis and management of ocular surface disorders and various corneal dystrophies and degenerations. In this age of electronic health records, one of the key concepts is connectivity. And with CIRRUS Review software, you will be able to review scans from your exam lane or back in your office. The forum system of archive and viewer eye care data management streamlines patient workflow by providing access to all patient examinations both locally and remotely. Integration of data and combined reports are now at your fingertips with the forum system. Here we can see the Humphrey Field Analyzer report combined with the CIRRUS OCT in a patient that is being followed for glaucoma. And so we have an excellent combination of information on the patient's structure and function, an ideal way to follow any ocular disease. Here is how transitioning to CIRRUS OCT can enhance your practice's growth and financial well-being, while at the same time raising the level of patient care. First, upgrading to CIRRUS OCT gives us the ability to add anterior segment imaging and, even more importantly, vitreoretinal OCT imaging to our practice. This will enable us to achieve reimbursement for a wider range of conditions. Reliability, confidence in the test results, and the excellent reputation associated with the CIRRUS and the Carl Zeiss Meditech brand is another advantage in upgrading your technology. It has been a real pleasure discussing these concepts with you. Thanks so very much for spending your precious time with me. I would be happy to answer any questions.